Dr. Shaheda Omar is a clinical director at the Teddy Bear Foundation, and she joins us now to also weigh in on efforts by the Free State government through this initiative to tackle teenage pregnancy in that particular province. Doctor, thank you so much. We really do appreciate your time with us today. Firstly, your response and your take on this particular initiative.
Okay, mixed feelings, because we are working with child pregnant learners, and I would like to labor and emphasize it's child pregnant learners, children who are under the age of 12. These are 10-year-olds who are children birthing children. So providing contraceptives to 10-year-old children is a highly sensitive, inflammatory, complex issue, and it involves child development. It involves considerations of ethics and public health, but it should not be a top-down approach. It should be a bottoms-up approach. When we speak to bottoms-up, it's to talk to the people that are afflicted and affected by this, by our pregnant learners, by the parents, the families, the guardians, the gogos, the traditional leaders, the faith-based leaders. We need to engage with everybody. We need to engage in dialogue circles where we are able to drive solutions and ensuring that there's an ownership for this. So if we look at some of the disadvantages of, handing out contraceptions, firstly, one has to look at age-inappropriate responsibility. Do children at the age of 10 have the emotional or cognitive capacity to fully understand the consequences, firstly, of sexual activity, the consequences and implications of undertaking and utilizing contraceptions? I think it's also normalizing this, that it's okay. At 10 years old, it's fine. That's the kind of messaging. So we have to engage in this dialogue to ensure that the correct messaging is actually understood, processed, and integrated and assimilated into the behavioral repertoire.
Doctor?
Then we, looking at the potential for misuse.
Yes, I mean, Doctor, yes. Yeah. Absolutely. You sound like my father, actually, because at this point, we know that the age of consent is actually not 10, right? So, and I think parents or guardians actually don't ask this question enough. What are some noteworthy health as well as psychological effects of early contraceptive use on these young girls?
And I think that's something we have to be very, very aware of, that are they able to understand how the contraceptives are going to affect their body? The hormonal changes as well. We cannot dismiss or discount that. So a lot of education, a lot of deliberations, dialogues, considerations from different stakeholders, role players, recipients of the services has to be, and there has to be engagement and involvement, active participation, where we can come together towards a medium understanding to ensure that we are promoting the best interests of children. By just eliminating pregnancy, is that really going to be an end to the problem, or are we going to create additional problems? So looking at the psychological impact, we might find there's confusion, there's distress, and children are not in a position to actually understand what is going on with them, and maybe engaging in and not having boundaries around their sexual activity, sexual behavior. They would maybe also at greater risk of being coerced into sexual activity, because knowing fully well that they will not be impregnated by the perpetrators. I think that's another thing. And taking into account that we cannot endorse and condone early sexual activity, which could certainly result in a public backlash. But there are pros to this. I think the unintended consequences of early childhood pregnancy, maternal mortality, infant mortality, maternal health issues, children dropping out of school, children not pursuing their careers. There are many, many challenges that we understand where government is coming from to try and protect and prevent this scourge of violence against children. However, I would still emphasize that this needs to be a bottoms-up approach. We need to engage, we need to dialogue, and we need to hear from children themselves.
Yes.
Nothing about us without us.
Absolutely, Doctor. And I suppose it brings into sharp focus the issue of what are the rights of children in this regard, leading to my next point, which is also the other important aspect of consent when it actually comes to the contraceptives being administered to these young girls. And maybe you also speak to us about some possible medical implications of early pregnancies. We know that the businesses of illegal abortion clinics have actually mushroomed across the country. And this is actually due to many other socioeconomic or even cultural reasons.
Indeed. So I think if we look at health implications here. Firstly, when a child is sexually active, we know that there's going to be, whether it's consensual, whether it's abuse, that there is a possibility of sexually transmitted infections, diseases. And I think there are complications from early pregnancy with younger children. There are complications and stillbirths, as I said, infant mortality, which can be, of course, not only physically harmful to their well-being, but emotionally. Imagine a young child birthing a child and giving birth to having a stillbirth, or having a baby with, challenges, physical challenges. And of course, something that we've also heard from the healthcare professionals is around the genital infections, the UTI, chronic urinary tract infection. So there are many other things that one needs to consider. And I think we understand that government is coming from an angle to protect abuse of children, to protect children from engaging in this kind of, suffering, basically suffering, because a child birthing a child and has to suckle a baby when they themselves need to be nurtured and taken care of and be playing on the playground, is now having to look after an unwanted infant into this world, which not only perpetuates a cycle of losses and a cycle of poverty, but it also prevents the newborn from any opportunities in their futures. I think these are challenges that we have to look at, but sex education and awareness is critical here if we want to ensure that children are in a position. You mentioned consent, and I think consent, we know the age of legal consent is 16, but we have to also look at the different pieces of legislation. If we look at termination of pregnancy at any age, unfortunately, it says 12, but at any age a child will receive. But if that child has to go for any surgical procedures, they need the consent of the legal guardian or parent. And so the pieces of legislation are also not speaking to each other. There isn't synergy, there's anomalies, and we need to address this so that we can synchronize how the pieces of legislation work to promote the best interest of the child. We don't want children to go out for, and do things behind the scenes where they find themselves in further risky situations. And therefore, we need parents to come on board and support this process that will promote the best interest of the child.
Absolutely, Doctor. I mean, at 10, we understand that a girl's body isn't even fully mature to be carrying a pregnancy, let alone a full-term pregnancy to term. And also, I think just speaking to this, we saw the furore, Doctor, around the mixed reactions pertaining to that case of a minor who actually gave birth during the recent Christmas holidays. And I remember, I'm not sure if you're familiar with that case, but when it came back, when the DNA was actually administered, it came back to this particular individual not being the father. But there was debate about whether or not the case was actually taken to the court because he had sexual encounter or had a sexual encounter with a minor. It wasn't necessarily because he had impregnated this particular minor. So that it becomes very important, Doctor, to educate around sex as well as contraception, firstly at home and in schools, because, Doctor, I'll always remind our viewers that we live in a multicultural country. Some families, it's still very taboo to talk anything sexual with your children. But the fact that you are not talking to your children, well, social media or someone else will talk to your kids, and it might be something that you will not necessarily like.
Indeed, and I think that's where we need to work from bottoms up. We need to empower, enlighten our parents of today, parents of tomorrow, on communicating techniques, on discussing sex and sexuality, ensuring that they are more equipped to reach out, to give their permission to their children so that their children are not found to be in a compromising situation. A lot of research has been done in this area around comprehensive sexual education. And what we have found is a lot of the learners, like you said, they go to social media, they go to the internet, they go to child sexual abuse material. So what is commonly referred to as pornography. And that is where they are absorbing their knowledge, not from a point of supervision, informed care, love. There's just absolutely nothing. It's cold, hard information that is not always correct. And I think these are the challenges we are faced with, where we need to also look at faith-based organizations and institutions where we get all our religious leaders empowered in ensuring that they not only equip all the children, but families as a whole on how to identify, how to manage, how to process situations of abuse, situations of early sexual debut. I think these are things that one cannot hide away. We have to bring it out into the open, but people can only communicate if they know how. So the skills, the transmission of skills is critical in ensuring that we get people on board, families on board, children, parents, everybody on board, even educators on board, to ensure that children are in a position to make an informed, positive choice at the end of the day. We must not take away their bodily autonomy from them.
And I'll be joining you in that fight, Doctor. I'm offering my time as we speak. Thank you so much for your contribution. As always, that is Dr. Shaheda Omar, a clinical director at the Teddy Bear Clinic.